Hello, I'm Dr. Kirk. I'm a board certified family nurse practitioner, and I'm an expert on the EEOICP program. I've done this for 10 years, and I'm here to help you maximize your benefits in this program and get everything you're entitled to and deserve. I'm going to show you the easy 1, 2, 3 steps to get amazing results in this program. You need this information, and I'm an expert, and I will help you advocate and navigate the process. Also part of our panel is Dr. Hugh Stevens, who's joining us by Zoom. And we will, after I present this basic information, we'll go ahead and open up the virtual webinar and also on the floor questions for Q&A about anything you might have related to this. So, there my slides are catching up with me. So the Energy Employees Occupational Illness Compensation Program was a law passed in 2001, and I'm going to give you a brief overview on Part B and Part E of the Energy Employees Occupational Illness Compensation Program. Now, one of the things that we have for you for participants that are joining us virtually or here in a physical place is we have a brochure, which you can see, and inside this brochure packet is just various handouts that we will send to you at no cost that kind of go into detail of these programs. So there's 2 parts to this program. There's Part B, which was enacted in October of 2000, and then Part E was enacted in October 2004. The various agencies that are responsible for administering this are the Department of Labor, also known as the DOL, the Department of Energy, known as DOE, what I call the scientists, which is NIOSH, the National Institute of Occupational Safety and Health, and the Department of Justice. Each one of these various governmental agencies plays a specific role, and we'll go into that in more detail. So the easiest way to look at this is Part B and Part E, because there's 2 different parts in each program. You may be eligible for benefits in one part, Part B, and not eligible in Part E, or you may be eligible in Part E and not eligible in Part B. And so as we kind of get into the weeds and the semantics of this, it's important to look at each individual case and go through that, because you can get lost, you can fill out a lot of governmental paperwork, and it can still be very confusing. So depending on where you worked at and who you worked for, whether you were a prime contractor or a subcontractor, depending on what years the facility is part of it, whether you were part of, atomic weapons employees, beryllium vendors, or RECA. Certain covered conditions. So usually covered conditions are focused on 2 primary systems in the body. One is the respiratory system, the other is the renal system. Other systems may be involved, but it depends again on where you worked, how long you worked, what work exposure you had. And so it requires some significant stuff. So in this slide, you can see on the screen, CBD stands for chronic beryllium disease. It qualifies for both parts. Beryllium sensitivity is only covered under screening under Part B, but under Part E, depending on the cancers, all cancers qualify for both Part B and E. Any condition related to a toxic exposure, that's specifically geared towards Part E. Then let's say you have a loved one who maybe would or should qualify for this. The government says we'll give you some money. And inside giving money, it's what they call a survivor benefit. It's $125,000. And so depending on whether you're the physical, the physical marriage, or it's a common law marriage, whether you have divorced and then remarried again, children, stepchildren, it gets very convoluted and very difficult to navigate, and it's very specific to each individual person. And so that's why we advocate in presenting this information to you and getting connected with an expert like Hugh Stevens here that is a lawyer. This is a law, And so the experts in law are lawyers, and that's why it's really great to have an advocate on your side that understands the law and can advocate you on a high level. So when we get into the meat and potatoes of the program, under Part B, it's $150,000 employee and survivor. Under Part E, it's $2,500 per percentage of disability. And so the way I like to use this analogy, if anyone's ever worked, let's say you're an electrician and Mrs. Smith hires you as an electrician to come change the light bulb in a garage door opener, because we all know those go out, right? And it's such a pain to try and replace them. So Mr. Smith, the electrician, he climbs up on the ladder, he changes the light bulb, and what do you know it, the Mrs. Smith's cat, goes underneath the ladder, and the electrician gets freaked out and he falls and he hurts his back. So he's out of work. He goes and sees the doctor. The doctor says he needs physical therapy and some medication. And pretty soon, Mr. Smith's been doing physical therapy for about 3 months. And then, he's exhausted his short-term disability, and then they decide to go on long-term disability. And so at that point, everyone understands, like Mr. Smith's back, the electrician, he hurt his back. His back is hurt. So the insurance is going to pay for all care related to his back. If he has hypertension and diabetes, although, those things may become harder for him to manage while he's out of work, the insurance is not going to pay for his diabetes and his hypertension. They will only pay for the injured part of his body, which is also known as the covered condition from an insurance standpoint. And so that's where using someone such as an expert like myself, a medical professional, to kind of navigate and specifically look for the tests that need to be ordered and should be ordered will help. So the Department of Labor is very specific when it looks at an injured worker and what kind of things that they're entitled to. So if you're before the age of retirement, you're entitled to wage loss. And wage loss is a percentage of this amount of money that you're entitled to. Under Part E as in Edward right here, we can see that impairment is $2,500 per percentage of disability. So 1% equals $2,500. 100% disability equals $250,000 tax-free. Wage loss is $10,000, $15,000 per year for the employee that they're out of work. Survivor is limited to $125,000, a lump sum and wage loss. So the total part of non-taxable compensation due to an injured worker, depending on when they were injured, how they were injured, and the percentage of disability, is $400,000, which sounds like a lot, but it's really not when you're a skilled tradesman or a pipe fitter, an electrician, blue collar, high level, high touch, valuable working. You're doing well for your family. $400,000 does not sound like a lot when you lose years of your life related to a cancer or something else. So the Department of Labor, and I'm not going to read all these slides to you. I'm not one of those presenters that will do that. I really feel the benefit of being able to do these things is really to have a Q&A and to get feedback according to your questions. But basically, they will verify employment. They usually do that if you're retired through what they call a Social Security earnings report. It has to be certified. It usually costs under $200, and it takes 5 to 6 weeks to get that information back. And then that starts the process of tying in your employment to a covered work facility to establish benefits. Other sources of information may come from affidavits, people you worked with at that site that know you if for some reason you were paid and don't have your pay stub or those records. Part B. So under Part B in the law, there's what they call dose reconstruction probability of causation. That's a big mouthful of words that basically says it is the claimant's responsibility through the medical evidence that they gather to show that your cancer was caused by working at the facility. So for instance, here in Wyoming, we had two areas where they purchased uranium, and they refine the uranium through the mill. And so we're bringing rock for underground mining sites, we're transporting it here, and then we're crushing that ore into yellow cake. And so as you crush the ore into yellow cake, it releases that radioactive dust, and then you're breathing it in. And that radioactive dust, if you kind of rub your hands together, they start getting warm. And you keep doing that, and you keep doing that, and pretty soon you have to stop because your hands hurt. So when you breathe in this basically very fine sand, they call it silica, your lungs, they inhale and exhale like this all the time, like this. Inhale, exhale, constantly moving. And in between your lungs, there's a lining called the pleural space. And so that pleural space has a very thin lubricating area. And so when you breathe in that yellow cake, what happens is you're breathing in fine sand, basically, and it's radioactive too. So not only is it killing the good cells in your body, it's also wearing your lungs out by that constant moving of your lungs. And so what we do know now is we know people need to wear respirators and N95, those kind of things, even with what we're dealing with here in the pandemic. We had a lot of response, but I'm sitting and I'm talking to a room full of chairs, and that's the nature of kind of where we are in healthcare today and where we find ourselves. But no matter what, you're entitled to these benefits, and the benefit of having an expert on your side is being able to navigate this complex process and know how to advocate. So in looking at certain areas, certain sites, the government says, okay, based on the data we've collected and what we do know, we know that some sites just have bad stuff. We didn't do a good job at protecting the worker. We didn't have the necessary safety precautions in place when you were working. So we know that because of these facts, which are well documented, we'll do what we call a special exposure cohort. Thank you. I can spit that out of my mouth. Cohort. And so, in short, it's called an SEC. And so the SEC basically says, if you've ever played the game of Monopoly, it's like pass, go, collect $200. It says, okay, you know, the reasonable and customary things you'd have to do to prove that your cancer was caused by where you worked at, you know, certain cancers, lung cancer and different things of that nature, we know were caused directly by you working at this site during these years. You have a cancer, we're going to cover that cancer and we're going to award you benefits because of that. The few caveats here, the devil's always in the details. And so for that, it looks at the worker group, where you were assigned, your employment, the particular location or specific process. You have to have worked 250 contiguous days. That means days within a row, or a total of 250 days to be eligible for that. They consider that if you work less than 250 days, that your exposure was not significant enough to have a cancer covered. Now, again, each case is specific, but in generality, these are the basic parameters this program has set forth. There are 22 covered cancers named by law. And again, this presentation is not to get in the weeds here, but to give you information that's meaningful and to start dialogue with you. So means of verifying employment, there's a form called an EE5. We talked about the Social Security wage earnings, and we also talked about affidavits. Part B, under Part B, what's required for covered cancer is a dose reconstruction and probability of causation. Wow, is that a mouthful? Dose reconstruction and probability of causation. So I'll let Mr. Hugh Stevens, he's an expert on that. I'll let him tell a story or two and kind of give you some stuff, but reading from you on these slides would be very dry. So we're gonna kind of leave that to the lawyer. We kind of touched on what an SEC is. Part B, adding new SEC classes, adding new work sites and different laws. That's constantly being looked at by NIOSH. All right, causation. So this is where the rubber really meets the road and why you would want to hire an expert such as Hugh Stevens, and then work with a medical provider such as myself to help you get to the finish line. It's not so much what you say, but how you say it. and the more medical evidence you have to back up your case, the stronger the probability that your case will be accepted if the facts are presented in a certain way. You know, there's a wonderful saying, my dad's the smartest person I know, and he said, you know, son, the older you get, the smarter I'll become. I'm 49 years old. My dad just turned 78. And to me, I love my father. He's the smartest person I know. But one of the things, you know, that I use in making that statement quite simply is this, that what you don't know is what you don't know until you know it. And then you wish you would have known it before you didn't know it. And so that's a really, if that sounds like a mouthful of words, it really is. And that's what this whole program is a mouthful of words. They're consistently inconsistent on how they determine and adjudicate a claim. And so the semantics of wording are very, very important in this program. And having someone that knows what to say and how to say it is important. But not only that, you know, the transparency of ordering and knowing what tests need to be ordered and how it's presented in a way that's articulate and clear. You know, if you want to go from they say the straightest distance between 2 points is a straight line. This is point A and this is point B. Those two intersect. You know, A is your beginning point, B is your end point. What if I add in C in there, you know, and then D? And so I go A, D, C, C, D, A, and then back to B, you know, and so you'd be amazed that, you know, sometimes they're sending you for a CAT scan. Well, okay, so we ordered a CAT scan, but what are we going to do with it? Why did we order a CAT scan? And so it's not only why did we order it, but what's the rationale? What are we going to do with that information and how does it impact your case? Again, all very significant points to consider. So the site exposure matrices, we kind of talked about, those are the different work sites. Employment impairment is determined by the American Medical Association's guides to the evaluation of permanent impairment, 5th edition. I'm a board certified family nurse practitioner, but I cannot prepare and do a disability rating. I do work with 2 physicians, Dr. Bradley Hughes and Dr. Christopher Marsh, who are certified by the American Board of Independent Medical Examiners to perform the disability ratings. I did this for 10 years as a nurse, and so together we collaborate, all 3 of the 2 physicians and myself, on each case, working closely with Mr. Stevens, and we work together to get the claimant the best possible outcome with the data that we have. And really, the true benefit, again, the money you get tax-free is a pittance, but being able to age in place at your home is also very important. So in talking about what are the claimant's responsibilities, this is really where the rubber meets the road and where a lot of people who don't have information are very challenged and need it. So this program considers your responsibilities to file a claim, to collect, copy, and submit relevant records, to respond to the information request, talk to coworkers, get affidavits if they needed, call the resource center, ask for help, review the decision and information for appeal. These timelines are very strict. They're 30, 60, 90-day responses. With COVID, that makes it challenging because it's hard to get in to see a provider, request your records and things of that nature. And again, the program is the program, and their rules that they have are put in place are very specific to that. So, you know, having an advocate in your corner is definitely something that will increase your probability of being able to get it across the finish line. There are 11 resource centers nationwide. You can find those at the Energy website. You can Google it as well. I did want to just touch base on areas specific into Wyoming. So if you worked at one of these sites, you feel like you haven't got the benefits you're entitled to, we would love to talk to you specifically. So the first site was the Spook site, where they had a uranium mill. It operated from till September 1989, 58 to 63. They had milling operations where they're crushing the ore. They also did remediation to clean up the ore from all the way until 1989. And so there's some very specific kind of things that we look at when we're looking at that. So the Spook Disposal Site is a former uranium ore upgrading facility in Converse County, Wyoming. You know, we have this information we're happy to send you. You know, if you work there, you didn't. It's listed as a mill site. In relation to Cheyenne, Wyoming, this is the disposal site where they disposed of the ore waste in relation to kind of where you can see where Cheyenne is and those kind of things. There was ore buying station at Crooks Gap in Riverton. Riverton also participated in the refining of the ore, and also they had a mill there as well. So I'd like to talk a little bit about Haven Home Health. Haven Home Health was founded by myself in 2011. I worked for a big box home health company who had challenges meeting the individual needs of the patient, and they didn't really support me as a nurse. So I decided to go out 10 years ago and hang my own shingle and open up my general store. And ever since then, we've grown day by day, patient by patient, mostly by word of mouth. And right now we are in 10 states with 16 offices. And we are very patient-centric. And what I mean by patient-centric is the patient and the patient's needs come first, and we build out from there. And it's focused on always what we can do to serve the patient's needs. Lots of companies will say that, but the devil's in the details. And so I would invite you just to take a look at the information we have and what we can present and what we would do in that regard. I'm going to turn it over to Hugh Stevens. He can present maybe a case study, one or two claimants that he's helped and some of the challenges they had. So at this time, I'm going to turn it over to you, Mr. Stevens. We got you on mute. We can't hear you.
Sorry about that. Thanks, Dr. Dallas. It's a privilege to be here. Thanks for asking me. I have enjoyed doing this work for the last 10 years. We've had many different challenges over the years. Much of what we do involves processing claims, and many of the claims that we process are claims that have been denied prior to the person coming to us for assistance. About 30% of those claims that go to dose reconstruction are approved. So we have about 70% being denied. I think generally throughout the program, there's something in the neighborhood of a 50% approval rate. And the reason for that is the Department of Labor will assist you with your claim, but the difference between the evidence that you need and the evidence that you think you might need are very often different. We need very good letters from doctors. And so your doctor might think that he or she is writing a perfect letter that says that you worked at one of these facilities and that it's contributed to or aggravated or caused your COPD or emphysema or asbestosis or something like that, silicosis. But if the doctor doesn't use the right words and doesn't provide a detailed explanation with objective clinical evidence and citations to peer-reviewed literature, the Department of Labor typically will deny the claim or will come back to the doctor and ask for clarification. Doctors who are very busy treating their patients often don't have time for this type of back and forth. And so we run into difficulties with that, and we have to encourage doctors to participate in the program and respond to those inquiries. So we do a lot of helping doctors provide these types of letters. And so very often what we get are letters from doctors that say the occupational exposure may have contributed to the illness. Well, that's not enough. We know that it may have contributed to. What we want is the doctor's opinion with respect to whether the illness was caused, contributed to, or aggravated by the occupational exposure. And that's why it's helpful. Kirk works with a number of doctors who take this type of occupational medicine seriously and write professional letters that often lead to approvals of claims, and very often of claims that were previously denied. So we run into that quite a bit. We also run into claims where the person has cancer, maybe skin cancer, maybe prostate cancer. Those types of claims give rise to a dose reconstruction. The dose reconstruction involves a health physicist estimating the amount of radiation that the worker received while working at one of the designated facilities. That estimate is then run through a statistical model that calculates a probability of causation, and it's based on the experience at Hiroshima and Nagasaki after the war and how certain cancers increased significantly. I suspect all cancers increased somewhat, but in any event, what happens is based on the level of radiation, you'll get a probability of causation, and 50% or higher leads to an acceptance of the claim. Now, the important thing there is the program is constantly changing. There is a process and there is a board, the Presidential Advisory Board on Radiation and Worker Health, and they decide whether the methods that they have been using to estimate dose are good enough and are up to date and are producing fair results in this claimant favorable program. Sometimes they decide that the evidence supporting these estimates of radiation exposure are simply insufficient to allow for a claim based on this weak evidence to be denied. And under those circumstances where they've decided that an estimate cannot be performed with sufficient accuracy, they create what's known as a special exposure cohort that Dr. Jollis talked about. The special exposure cohort means that for a certain time period at a certain facility, at a designated facility, those patients, those workers or claimants with one of 22 cancers. And those 22 cancers are the cancers that you think of except prostate and skin cancer. Prostate and skin cancer happen so often in the population that they decided in the legislation not to include those in with those cancers that will be accepted based on a presumption. So if you have one of the 22 cancers, you were at one of these designated facilities, these special exposure cohort facilities during the special exposure cohort time period, then, and you have 250 days, then your claim is paid based on a presumption. So those claims are good claims. They tend to go through the process relatively well. It usually takes somewhere in the neighborhood of 6 months to have a claim like that processed. Typically, claims are processed within 6 months, although those claims that involve a dose reconstruction, take a little longer. The dose reconstruction process can take 6 months on its own, and so that adds to the time period. Another thing I wanted to talk about is they have industrial hygienists and contract medical consultants. So if you can't get a good letter from a doctor in support of your Part E claim, and I'm going back and forth between Part B and Part E. Part B is primarily cancer caused by radiation. It also includes beryllium disease, which is a lung dysfunction, and silicosis, another lung illness. But primarily, we're talking about cancer caused by radiation under Part B. And so if there's a special exposure cohort, that decision is made based on a presumption. If there is no special cohort, or if the cancer you have or the cancer involved is not one of the 22 cancers, so if you have skin cancer or prostate cancer, that's going to go through the dose reconstruction process as well. But under Part E, we're talking about any hazardous substance that causes any illness. So all you need to do is identify some hazardous substance that you're exposed to at the facility, and that you have an occupational illness associated with that hazardous substance. So typically what we run into is asbestos is all over, and the Department of Energy acknowledges that asbestos is pretty much at every facility, every designated facility. There are 382 of these facilities. Now that I'm talking about Part E, I should mention that Part E only applies to Department of Energy facilities. So those are facilities that are owned and or operated by the Department of Energy. It does not include facilities that are known as atomic weapons employers. Those facilities only have, they're private facilities, and they have a contract with the Department of Energy. So there's certain facilities, the ones that are the biggest ones around the country, the Nevada test site, Hanford in Washington, Oak Ridge in Tennessee. Those are some of the ones you think of, but there are many, many more of these Department of Energy facilities. So at a Department of Energy facility, and this gets a little bit complicated, but the mines, the uranium mines are also in a way considered Department of Energy facilities, not because they're not privately owned, but I think it's because, and I'm not entirely sure about this, but I believe it's because uranium was nationalized prior to 1972. So the government owned all the uranium, even though it was still in the ground. So you couldn't privately own uranium before 1972. And so in the radiation exposure compensation program, uranium miners, millers, and transporters are compensated, and they receive compensation from the Department of Labor as well as from the Department of Justice. But anyway, the point is that any facility that is owned by the Department of Energy, or any uranium that leads to occupational illness in a mine, the Department of Energy will compensate claimants if the occupational illness is shown to be caused, contributed to, or aggravated by the occupational exposure. And there are a few more words they like to hear, and that's that it's a significant factor contributing to, aggravating, or causing the occupational illness. So the occupational exposure is a significant factor contributing to, aggravating, or causing the occupational exposure. There's one more piece of that, and that's that it's at least as likely as not. So that means that it's a 50-50 proposition. So here in this, what they call a claimant favorable program, all you need to do is show that it's at least as likely as not that your occupational illness was caused, contributed to, or aggravated by your occupational exposure. So that's where these letters from the doctors come in. A good letter from a doctor is very, very important. And so it's important that you work with a doctor who is willing to take the time and to focus on this. There are certain doctors who do it pretty regularly. If a lot of their patients, are patients that worked in these designated facilities, but very often we run into letters that are just weak, and the Department of Labor will say, "Oh, just get a letter from your doctor." Well, if you just get a letter from your doctor, very often it'll be a letter that's not very good. And what happens then is the Department of Labor will send the claim to an industrial hygienist who will describe the frequency and intensity of exposure. And then the report from the industrial hygienist will be sent to what's known as a contract medical consultant. And so that's a doctor that's hired by the Department of Labor to write reports about whether your illness was caused, contributed to, or aggravated by your occupational exposure. And as you can imagine, the contract medical consultants don't tend to side with the claimants as often as we'd like. So the contract medical consultants working for the Department of Labor tend to find that that their illnesses are not caused by or aggravated or contributed to by their exposure. It's not that they don't ever find that there's a connection. It's just that they tend to err on the side of the Department of Labor, whereas we're looking for a doctor who's willing to work with our claimants. It's a matter of how they approach the program. So we run into a lot of those contract medical consultant reports, and so the real goal in this program under Part E is to avoid the contract medical consultant report. And there is a certain level of preference for a treating physician, a physician who has actually met with the claimant, that kind of thing. There's a certain preference for that within the program, and if a treating physician does provide an opinion and the claims examiner finds that opinion is not clear, it's not compelling, the claims examiner is supposed to go back to the treating physician and get some clarification. The problem is that the claims examiners are in a big hurry, and so it takes a long time to get an industrial hygienist report, and then when they're under the gun, because they need to decide these claims generally within 6 months in order to meet their internal goals. And so in the beginning, you'll find you have to call the claims examiner and try and get the claims examiner's attention. But as the 6-month mark comes along, the claims examiner is calling you, and they want to know what's going on, and they want to make sure they get their decision written by the deadline. So those are the issues we run into. I think one of the things that I like to tell people about is, first of all, if someone is terminal, these claims can be resolved within weeks. Sometimes that's a little ambitious. Maybe it takes a month, but or even 2 months. But they move very quickly if you can get a good terminal letter for a claimant who is terminal. And so that becomes very important. The wording of the terminal letter is very important. The expedited claim, the method of expedition is related to a claimant who is not expected to live more than 6 months. And really, the point here is that this process takes about 6 months. So if you've got a claimant who's not going to live that long, or who might not live that long, the claim ought to be expedited. And the Department of Labor is very good about expediting cases if you have a good letter, if you know what that letter needs to say. And I think with all these letters, we talk about magic language, at least as likely as not a significant factor aggravating, contributing to, or causing the illness. But it's really not just that. It's not that silver bullet language. What it is a clear and compelling statement, a clear and compelling argument that is supported by objective evidence. And that's what we're really looking for. And that's true of a terminal letter. It's true of any kind of letter in support of a claim. A couple other things before I finish up here. One is this compensation is not taxable, number one. But number two, it's also not considered a resource for purposes of state and federal means-tested programs. So someone who is on Medicaid doesn't lose his or her Medicaid because of receiving a payment like this and doesn't have to pay tax on it. We suggest that people who are receiving this compensation, that those people set up a separate account. So if ever they need to take advantage of the special nature of this compensation, that they can prove where the money came from. Finally, all these claims, all these cancers, you can have a claim within the Department of Labor. You could also have a state workers' comp claim. You can have an asbestos-related disease state tort claim, state or federal tort claim. If you're a federal employee, you can have federal workers' compensation claim. It becomes very important to coordinate these claims, and it's very important to meet the statutes of limitations. So this program does not have a statute of limitations, but all the other programs do. So if you want to file for state workers' comp, it's generally a number of years after diagnosis. So once you knew or should have known that you were sick and that it was caused by your work, you need to file a claim. Same with tort claims, a certain number of years after you're diagnosed. This is true for asbestos claims. There are leukemia claims caused by diesel, benzene, which is in diesel fuel, lots of asbestos claims. And so it's important to know that you need to move quickly on those and that they need to be coordinated. But I've probably used up more than my share of time here. I'm going to turn it back to Dr. Jolles, and perhaps some folks have some questions.
Thank you very much, Hugh, for that informative tidbit on what it's like to navigate it. I know that's your day job. For me, this is my day job in navigating these letters and stuff. And so I want to leave the audience with a closing thought. And so, you know, words are very powerful, but I'm going to let someone else do the talking for us today. Here we go. So everyone, sometimes it's just really not about the nail. Our job is here as a panel of experts is to help. That's the reason we exist. We're here to serve you. We have strategic alliances to get you what you're entitled to, medical equipment, wage loss, a variety of things. All we need you to do is engage us in dialogue. So our information, our phone numbers, our emails will be attached, a way to text us. Our goal is to keep you safe and to keep ourselves and our families safe during this pandemic in time of COVID-19. And so we thank you for watching this video, participating in this webinar. However you may have done it, we appreciate your time and what you've given us. Stay safe out there, be blessed, and good day.